Hi, I'm Dr. Terranella, a naturopathic physician here at the River Source, and today I'm going to talk about detoxification. So what is detoxification? We use the term detoxification to apply to removing unwanted toxic substances from our bodies. Traditionally, this applies to things like overdoses of Tylenol, acetaminophen, or heavy metals, where you would actually get chelation therapy to remove those toxic substances. It also applies to the process that your body goes through to remove those toxins. Through the liver, through the kidneys, the processes that happen, it's called the detoxification process. So what is the purpose of detoxification? Like I mentioned, it's toxic substances, so you want to get those out of the body because they can be harmful to tissues. It can cause damage to the liver, the kidneys, and as well as it can kind of interrupt the normal functionings of the body, the metabolic functions, the brain function, etc. So the purpose is really to get those out so that those things can function to their optimal. So how does this apply to substance abuse? So when you're using substances like alcohol and Xanax and those things, they have a certain rate that they're eliminated through the body, which is based on the half-life of those drugs, substances. Like Xanax, for instance, has about a 6 to 8 hour half-life. So half of it will be out of your system, and then you take another one. So those, when you go through detox, speaking of substance abuse detox, you're really, it's a bit of a misnomer because your body's always going through the detox process. What you're feeling during the detox is withdrawal, and the withdrawal is from not having the substance in your system. So you're eliminating that last bit, but you had a certain steady state of that drug or substance in your system, and your body's always eliminating at a certain rate. When you go to detox, you are withdrawing, technically speaking. And what we do is we give you medications to kind of help with those withdrawal symptoms. So in the substance abuse or addiction world, a lot of times patients are prescribed medications for things like anxiety and depression, when really those are sometimes they're needed, sometimes they're not, and as more of a manifestation of the withdrawal symptoms rather than their organic nature of their, how their brains normally function. So once you eliminate the substance from your body and give it a chance to reset to a normal state, a lot of times the anxiety, the depression, all those things kind of go away, in conjunction with working the 12 steps and doing all the spiritual things, giving your body the vitamins and nutrients it needs. A lot of times you can regain a normal state without the use of medications. That's notwithstanding the withdrawal symptoms need to be treated with medications in most cases, but the anxiety and depression that result from using drugs and alcohol are oftentimes short-term. They're not something that stays with the person long-term. In my experience, working in this field for 5 or 6 years, it's typically 30 days cleaning your body out. Those things start to reset, and those symptoms of anxiety, helplessness, they tend to dissipate. And there are certain cases where medications are needed as well, but most of the time they're not, in my experience.